Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program.
On today's edition of Helping Seniors TV, Dr. Lee N. Sheldon, noted area periodontist and co-founder of the Institute for Dental Professionals, joins Helping Seniors TV host Joe Steckler, and they cover the topic of smile, form, and function on today's edition of Helping Seniors TV.
I'm Joe Steckler, and I'm in the studio this morning with Dr. Lee Sheldon. Dr. Sheldon is a periodontist. Welcome, Lee.
Hi, Joe.
I see. You see, folks, you see that bright smile of his. And what he likes to do in his advertising is talk about how his dental implants can make you have a brighter smile. And in general, you're the one who's tearing your face apart, not me.
Now, I did this without dental implants. These are all mine. Now, they've been decorated a little bit. I will admit that. These 8 teeth, these are veneers. So these were placed over my natural teeth. Remember when you and I first got together?
Yes.
And those of you in the TV audience, when we first got together, I had spaces between my teeth. I don't have spaces anymore.
Well,
that's all done with veneers.
What it is because you know that a good dentist doesn't use floss or doesn't do any of that stuff, and all that plaque builds up and fills your teeth in.
Is that what we got?
That's what you did.
Well, it'd be a cheaper way of doing it, that's for sure.
No, that's not what he did, folks.
Thank you.
Actually, I believe that Dr. Sheldon is probably one of the top periodontists that you're going to find any place. And I do know, Lee, that I have never met a patient that went to your practice that was not satisfied.
Oh, thank you.
No, I'm serious. I'm not joking now. I'm not joking at all. And I think that's one of the reasons, because you treat your clients fairly. You make sure they know that if there's a problem, you give them your personal phone number. You tell them to call you if there is a problem. And not many doctors do that. I don't care whether it's a dentist, a medical doctor, or any kind of a doctor that practices in the field of medicine. You care about your patients. That makes a difference.
It's true, and I've got to tell you, my patients never abuse that privilege. You know, you're always frightened. You're going to give your cell phone number, and that way they're going to call you at midnight. They're going to call you on off hours. Nobody abuses that privilege, so why not? Let them know that they can communicate with me.
Well, see, I got an advantage over you that you don't have.
What's that?
I'm hard of hearing, and when I take my hearing aids out at night, it wouldn't make a difference if I gave it my cell phone or not.
Okay.
But we're not going to sit here and joke about Dr. Sheldon or me. But what we want to talk about this morning, folks, is the bite discrepancy. And in all the shows that we've done over the years, we have never talked specifically about the bite discrepancy, the importance of it, and why people need to know how the bite discrepancy can affect your overall health.
You're right. I brought my friend here. Now, you'll be able to see a little bit more of my friend in a minute, but let's talk about the overall concept of a bite. And let's make it simple, because as dentists, we've made bites pretty complex. And there are reasons for complexity. But let's go down to the simplicity. When you close down, like that.
I'm doing it right now.
Every single tooth should touch. Your front teeth should touch. Your back teeth should touch. If less than that touches, fewer teeth touch than all of your teeth, then the individual teeth that are touching are taking more stress than they were designed to take. That can create problems later on. Let's assume instead of biting on a series of 14 teeth, 14 in the upper, 14 teeth on the lower, 28 teeth, not including wisdom teeth, let's assume that only two teeth were in contact. You have muscles in your jaw or around your jaw, both on the inside and the outside, that apply a certain amount of stress. Those muscles have strength to them. if there's only one set of teeth that is contacting when all those muscles are working, what do you think is going to happen to those teeth? Either they're going to get loose or they're going to crack.
You're going to grind down too.
Correct. So yeah, and the body will you're absolutely right. The body will make an effort to grind those teeth down so that the other teeth start meeting. That's when we start bruxing or we start grinding our teeth. That's one of the reasons for bruxism.
So what exactly is a bite discrepancy?
So if fewer than the 28 teeth are missing, that is a bite discrepancy. Now most of us have fewer than 28 teeth touching, but when we have less than that, then that means that each of the individual teeth are taking more stress than they should. It becomes a problem for us as dentists because our goal is to restore you so that all 28 teeth are touching. Our goal is not just to make things look good, not to give you the smile, but also to be able to give you function, to be able to make sure that all of the teeth are taking their share of the load, but no more than their share.
Why is that really important, though?
Well, let's assume you're 21 years old and you have a tooth that's badly bombed out. Okay? And you decide, I'm going to extract this tooth. So let's assume that we extract one tooth here. All right? And it's a back tooth because it doesn't show. All right, well, this tooth, we didn't take care of it, so this tooth comes out too. Okay, and then we do the same thing on this side, so this tooth comes out, and this tooth comes out, and all of a sudden, the back teeth don't show, but if I'm placing stress on the teeth, it means when I'm pushing down, it means those teeth are going to move a little bit.
Why are the front teeth moving?
The front teeth move at an angle. So the front teeth move like this, hit like this. If we don't have enough back teeth taking the support that they should, then when you bite down, you're going to do this to your upper teeth or do this to your lower teeth. It becomes a problem later on. So that if we have a patient who's lost most of his or her back teeth, it's not unusual for spaces to develop in the front teeth because they're hitting at an angle. We think about front teeth, we want them to look good, but unless we have support from the back, the front teeth are going to continue to have stress.
But I think about shows that we've done in the past that we've talked about what we call TMJ.
Yep.
And that's where you get stress back in the back part of the jaw when you bite down.
That's right.
And if your front teeth are at an angle, it's going to put stress here, and it's going to cause problems through your neck, and it'll cause headaches.
Absolutely right. Think of the front teeth as a wedge, and you're right. The upper teeth are acting as a wedge on the lower tooth. The lower tooth is pushing the jaw back. Where's the stress going to go? Exactly where you said, right there. And when it goes right there, it's not just hitting the jaw. It's not just hitting the jawbone. It's not just hitting the cartilage, which is between the lower jawbone and the skull, but there are muscles that are attached to that jaw, and those muscles have other attachments that indirectly go right down here. So can we have shoulder pain as a result of a bad bite? Of course we can, because the muscular stresses get translated from one place to another. It's not unusual for somebody to have lower back pain as a result of a problem in the jaw.
Well,
so yeah.
I recently had what they call a mitral valve clip procedure, where they went through my groin, went up into the heart, inside the heart, into the chamber, and they did a clip procedure where they went out through the mitral valve into the other part of my heart and opened this thing up, came back and clipped my mitral valve, the area around it together so that my heart wasn't pumping as fast.
Okay.
So the surgeon that did this made it very clear to me and the post-operative talks that it was extremely important for me, as with many people that have had heart procedures, to pay very close attention to any invasive procedure that went on in their body, and to go back to taking something like amoxicillin before you had your teeth worked on, before you had a teeth cleaning. And I thought for years that we had started to get away from that. But now, after listening to that surgeon, I find that's not true. Why?
Well, we have gotten away from it, and it depends upon the procedure. If you've had a valve procedure done, we are still pre-medicating. But we were pre-medicating for a lot of reasons at one time. We were pre-medicating because somebody had rheumatic fever as a child. We were pre-medicating because somebody had a mitral valve prolapse.
Right.
There were a lot of reasons why we pre-medicated. And we looked at that over a period of time, over a period of 55 years. And we found out the patients that we pre-medicated didn't do any better than the patients who we didn't pre-medicate. And as a matter of fact, there was some evidence that showed that they were doing worse as a result of taking an antibiotic for every dental procedure. So we've pared that down. We're using fewer antibiotics. But still, when we're dealing directly with a valve, there is still some evidence that, in fact, it may help you to use antibiotics. And so antibiotics are prescribed as a one-time dose 1 hour before the dental procedure.
That's exactly what he said to me.
Yeah.
So, you know what the importance of it, Lee, is understanding what we're talking about. Bite discrepancy, why is it important? How does it affect us? The complications from a bad bite. Can dental work make a bite better or worse? What does they mean by that, making it better or worse?
I want to show a couple of things here, but I got to put my teeth back.
Yeah, put your teeth back in.
Yeah, it's very easy to put my teeth back in here. This is not exactly the way a dental implant is done, but it's close. So let's put the teeth back so I can show something for a second. You know, there was something that we wrote about in the Ultimate Mouth Manual years ago. I called it the load test, and we wrote about it in Florida Today. You and I talked about it on radio. We're on TV now. I've never been able to show the load test. So this, I don't know if you can focus on it, if you can see it, but okay. So this is a piece of shim stock. Now you think of shim stock as something that's used as a building material, something to take up space. Well, we have something like shim stock. You can see how thin it is. And shim stock is what we use to determine whether teeth are in contact or not. Can you buy shim stock? You can buy anything these days. So you're looking for 12 micron shim stock, SHIMSTOCK. How do I use it? Well, I want to know whether teeth are in contact. So what I'll do is have the patient close down, and I see if I can pull it out easily. If I can pull that shim stock out easily, what does that mean? It means those teeth aren't contacting. Got it. And let's put it on a tooth where it is contacting. So we put it in, and now I try to pull it out, and I can't pull it out. That means that tooth is contacting. That's important because if people have dental work done, they have crowns done, fillings done, the lower tooth should be in contact with the upper tooth when we get all done. It's our goal. If we don't fulfill that goal, then we're not helping you. If we put a dental implant in, and we put a crown on that dental implant, and that crown isn't touching the opposing tooth, we're not helping you. So that it's important that as we're doing our dental work or assessing the dental work that we've done, that we test it with shim stock, and there's also something called articulating paper, which actually puts a mark. It's like a typewriter ribbon. I'm saying typewriter ribbon. Who knows what a typewriter is now? Carbon paper. Who knows what carbon paper is? It's you get the idea. This is focused on seniors. Some of you know what I'm talking about.
That's when you say click or take.
Yeah, bite down. And you want to make sure that, in fact, the teeth are in contact. If they are, that's great. Now, sometimes they can be in too much contact. Let's assume that we put in a filling and it's too high. Okay. If that happens, well, in the old days when we had silver fillings, they'd break. In today's dental materials, we don't use silver nearly as much anymore, and we use plastic fillings. If those plastic fillings aren't in contact, or if they're in too much contact, then that tooth is going to take more stress than anything else. If you have only one tooth contacting, and you say, "Well, I'll get used to it. Let me see how it goes." How it goes over a period of time, that's probably not a wise decision because your jaw is going to adjust. You've got all sorts of flexibility up here. The jaw will adjust, the muscles will adjust, but that may be to your detriment. So the goal is when we do dental therapy, when we do any crown, we do anything on the top surface of a tooth to make sure that contact is the same on that tooth as every other tooth in the mouth. When we have that, then we pass the load test. Now, why did I bring up the load test? You can test yourself. You can determine whether your teeth are in contact or not. You can buy some shim stock, or if you want to take some cellophane, some very thin cellophane from a wrapper, but it's got to be thin, you can place it between your teeth, right down, and see whether the teeth are in contact. You can test yourself. And if you find that most of the teeth are in contact, that's great. And if you find out that only a few teeth are in contact, then those teeth that are in contact could be in jeopardy of loosening or cracking And so, you want to see your dentist to either do a bite adjustment or to fill in the spaces where the teeth aren't meeting, so that in fact you pass the load test so that you have equal contact among all of your teeth.
Okay, let me give you a theoretical problem.
Okay?
Let's say it would be my assumption that most people that have dental work done, and when a doctor says bite down, they feel their teeth honest. If they're really honest, they'll tell you that it doesn't feel right, because I don't know of any time I've ever been to I've had a lot of dental work done. And whenever the doctor dentist tells me to bite down, it doesn't feel right.
Okay.
And I tell them. And then the more they take off, I begin to get concerned about whether I should wait and let my mouth adjust a little bit, maybe several days before they grind any more off. Because there is a danger that I would assume there's a danger that they could take too much off.
There is the danger you can take too much off, and then you flunk the load test on that tooth. Besides that, if you've been sitting in the dental chair with your mouth open for a half hour or an hour and a half, how good are these? How well are these muscles really working?
Yeah.
They're not working that well. And so sometimes it is worthwhile waiting a few days, let the anesthetic wear off, because that could influence things as well, and then go back and check and make sure they're
okay. Let's say if it does grind too much off, what can you do to rectify that? How do you build the teeth back up?
With a crown, you can't do it. You can add, well, I shouldn't say you can't do it. It's difficult to do. You can add some filling material onto the top of the crown, which is a temporary solution. Or if you're not sure, what the dentist will do will be to temporarily cement in that crown, check your bite in a week or so, and if it's not okay, take that crown out, send it back to the lab, and have the lab add to the top surface of the tooth. That's a permanent solution, and then re-cement the crown.
So what we're saying is that just like a doctor might ask you a question about medications you're taking, and the wise person taking medications will sort of admit to themselves that I know how I feel better than a doctor knows how I feel, and that's true.
Yep.
Because even a dentist, you can think of all these things that need to be done for filling work and for dental implants and everything, but the person sitting in the chair knows how the mouth feels, or knows how his body feels, or knows what reactions are. So the really dumb person is a person's afraid to tell the doctor or the dentist how they really feel.
I think so, and it's true, because you want to, we all want to please.
Yes.
And sometimes pleasing isn't the thing, or we just want to get out of there. Sometimes it's good. In fact, always it's good to advise the doctor, advise the dentist, in fact, what's going on, and let the dentist advise you as to what the next step is.
All that we're talking about today, Lee, why is this so important that we think about bite discrepancy, the problems with the jaw, what we're putting into our bodies as we grow older? What are some of the real problems?
Well, let me tell you about a patient that I just saw this week. And that's where this is coming from. Even though we wrote about the load test years ago, this is where it's coming from. So I saw a patient for a second opinion. The patient had seen a general dentist and had periodontal work done by the general dentist. The periodontal work didn't come out so well on one tooth. And so that dentist sent the patient to an oral surgeon to have all the teeth taken out so implants could be done. So the patient comes in to see us for a second opinion. After all, we extract teeth and do dental implants. We do that all the time. But we also save teeth, so we can look at it from both perspectives.
Well, I think it's key that what you just said something, save teeth.
Exactly right. So what did I find out? Remember we said there was only one tooth, in my opinion. I think my opinion is pretty good. What do you think?
I think it's good because you did. I'm very happy with what you did to me.
Well, thank you. So there was only one tooth where the periodontal disease wasn't solved. What do you think I found when I did the load test? That was the only tooth that was in contact. And so it was being pushed out like this. So what's the answer? Do we take out all of the teeth in order to be able to solve the problem on that one tooth? No, we grind that tooth down. And then we clean that up periodontally and take care of the infection. And that area will heal. Even if that area doesn't heal, the rest of the teeth are fine. We can use the rest of the teeth to support a fixed bridge. We don't have to take out all of the teeth. So the patient comes to me because we do both. And the first thing I said as I looked at it, and I really had to convince him of this, he was 77 years old. I had to convince him that the rest of the teeth are fine. We only have to solve the problem with this one tooth. Do you want to try to solve the problem with this one tooth? Great, let's do it. It may not work. If you're willing to go through it, let's see if we can solve the problem with one tooth. If we can't solve the problem with the one tooth, we can still just extract that tooth and make a fixed bridge. That means something that's cemented in place to the natural teeth to replace that one tooth, and everything will be fine. And he'll be able to function with the rest of his teeth for the rest of his life.
Yeah, well, I have a fixed bridge on my upper side here.
Yep.
I have my dental implants on this side, and I can't tell any difference. I think what more people have to understand, Lee, about bite discrepancies and how we correct these situations is that by getting the right opinion as to what we need to have done is so very, very critical.
Yeah,
It's very critical.
It is. I refer out to specialists all the time. Myself, I'm a specialist, but there are specialties in other areas of dentistry. Well, there are some specialists that I like. There's some physicians who like other physicians. Why? Because of the thinking that goes on before making a decision to do something. All of us are good at doing things. Sometimes it's making the decision as to whether it's a good idea to do something or not do something that's more important than how good we are at doing that.
Considering the area of bite discrepancy, I cannot imagine, after having watched you work with the updated equipment that you have in your office, that you would have to refer somebody out. Can you give me or give our viewing audience an example of somebody you would refer out that you wouldn't take care of?
Sure. A patient needs a root canal, for example. We don't do root
Oh,
canals.
I forgot about that.
Yeah. So if a root canal is necessary, we'll send out to there's a particular endodontist that I like. I like others as well, but there's a favorite that I've been working with for 25 years, and he and I have a great relationship, and I know that when he looks at the patient, he's not going to automatically do a root canal. He's going to assess first. He's going to come up with the pluses and minuses and then decide whether it's okay, whether it's going to be worthwhile for the patient to do a root canal. And that's the kind of person I like.
But most important, you don't have to go back to explain to that patient why he got hurt so much in doing a root canal, because you didn't do it in your office. The other guy hurt him the most.
Root canals are very comfortable. They can be done very, very comfortably. But done, let's make sure we understand this. A root canal done by an endodontist. Somebody who does root canals 8 hours a day, that's the person you're most likely to have the best experience with, because that's what he or she does for a living.
But generally speaking,
yes,
those are not done by those kind of people. A lot of them are done by general practitioners, and sometimes those darn things can hurt.
I think that when you have the ability and the advantage of being able to see a specialist for a particular something, I don't care whether it's in medicine or dentistry or plumbing or wherever we're looking, if we have a specialist, somebody who does this, knows how to assess and knows how to do it really, really well, we're always better off in seeing the person who does it all the time.
And I think something else that the viewing audience needs to understand, Lee, and probably we don't have much time left, but we could touch on a little bit, the importance of understanding that in the field of dentistry as compared to other medications, since Medicare does not cover all the procedures that could or need or should be done on a dental patient, people have to make a decision as to whether they want to pay for some of this out of their own pocket.
It's true. It is a monetary decision, and it's different when you're making a decision out of your own pocket. If it's paid for, as long as they're paying for it, it's okay. But when you're actually taking the money out of your own pocket, you're right. There's a certain other consideration you're looking at. Is it worth it?
But that's the point I'm trying to make. I think it is worth it, and whether you give up 4 or 5 meals from eating outside and stay at home and eat a sandwich or something, which costs you a lot less than going out for dinner, that will pay for the improved type of care that you can provide to your mouth. And this is something people need to think more about.
It's true. It's true. And there are certain assumptions that are made. And if the assumption is made, he can do it or she can do it, I don't have to see the specialist, just because he or she can do it doesn't necessarily mean that that's the right person to see for it. Because our opinion of whether we can do it or not, example, general dentist doing periodontal work and failing and then sending it to the oral surgeon because that general dentist said, well, nothing can be done. Didn't even send the patient to a periodontist, and then the patient seeing a periodontist, the periodontist saying, number one, you can keep most of your teeth. Number two, we can even keep the tooth that we think is failing, or at least we have a shot at it. Here's what we do. Do you want to pay for that or not? Do you want to pay for the shot? And I said, it's a 50-50 shot either way. The patient can decide, does he want to go through the procedure to try to save that tooth or not? He knows up front what will happen if we do save it. He knows what happens if we're not able to save it, and he can make the decision as to whether it's worthwhile spending the money to try to save it or not.
Okay, we've got about a minute left. But I'm going to quickly explain this. Attention to periodontal problems from parents and children, if they're acted on at an early age, can often prevent serious periodontal problems and bite problems as you age.
Yeah, if we're looking at bite problems, kid bite problems can cause a big problem, not just with the teeth, not just with the jaw relationship, but also with the airway. And so that we have to make sure that in our kids, if you're looking at your kids or grandkids, that in fact they're being assessed by a capable pediatric specialist, I'm talking about pediatric dental specialist, to make sure that every consideration, teeth, bite, jaw relationship, and even airway, are improved or maximized at that time, because that's the time when your jaw is developing. Perfect time to do a little bit of orthodontics if necessary in order to be able to make sure that everything's going to be okay.
We're out of time, but we'll pick this up on another show sometime. But I want to thank you, Lee, for what I always think is when you explain something to our viewing audience, they understand it. And I want to thank you a whole lot for being with us today.
Thank you, Joe.
I always do enjoy doing a show with you.
Me too.
Thank you very much, Lee. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.